largely looking at how things were done elsewhere, how things were happening here. Small things like, when you have to wait in a waiting lounge in a hospital, you are sharing space between someone who's recovering from something, someone with an eye patch, someone with a broken limb. It is not the same feeling, right? It's a very different atmosphere. So here we wanted to kind of change a lot of those dimensions. So you would come into a nice place where you don't feel anxious. You would feel nice to come there, right? So that was the objective. So we had to kind of do a 180 degrees of what healthcare was and try and come up with a new sort of paradigm.
And the three of you started Cloud9. What was that one core insight which led you to zero down on the idea? I mean, what was that one unique friction which you were trying to solve? What was something that you were trying to do 10x better than others?
I think very honestly, if you look at what pregnancy is all about, right? So traditionally, there were the nursing homes where you would go to knowing that the doctor entrepreneur who has set up the nursing home, either him or her, you are going to that nursing home with complete belief in this individual and not worrying too much about process and stuff. That is nursing home. You go to a corporate hospitals at least positioned in a way that it was all about process and you don't really worry about the individual doctor and as such, right? So there was the entire process orientation, there was the entire personalization. We said we can bring this together, right? On top of all of those things, on a first principle basis, the simple merit of the idea was to say that, hey, look, pregnancy is something in healthcare specialty which is not illness, it is wellness, right? So I think that core philosophy changed everything that we look for.
It's supposed to be a pleasant experience.
It is. And from a health perspective, right, like why do people go to hospitals, right? You're sick, you're not doing well. You need to go to a place where they'll get you back on your feet and you go back home, right? It's a very simple paradigm of where it is about getting better from a place of illness, right? In childbirth, in pregnancy, you're actually doing pretty well from a health point of view, that you're able to carry a life within you, right? So that needs a very different atmosphere, and that was the aha moment, right? To say, hey, it doesn't exist. It was done very differently in different countries while not giving it the sphere or the dimension that we've kind of brought together. So there was always that opportunity. There was always the entire aspirational intent of how folks in our country were also looking for something like this, right? In hindsight, I can tell you there are three classical milestones of how spends happen, right, in an individual's life. One is obviously, as they grow up, it is about education, which is the highest priority, where people kick well above their weight to kind of give their kids the best education. If you go after that, the marriage is the biggest sort of, if you look at a per capita income, if you have to see what is your spend on that per capita income, then you would see that marriage possibly takes the highest kick. The third biggest was childbirth, right? So people do want to kind of give it that sort of they want to be able to celebrate that, but there was no avenues, right? So it actually went back to very basic first principles. We didn't even have to kind of reach out to too many people and put a lot of design thinking. It was about all the first principle thinking that we all had, largely looking at how things were done elsewhere, how things were happening here. Small things like, when you have to wait in a waiting lounge in a hospital, you are sharing space between someone who's recovering from something, someone with an eye patch, someone with a broken limb. It is not the same feeling, right? It's a very different atmosphere. So here we wanted to kind of change a lot of those dimensions. So you would come into a nice place where you don't feel anxious. You would feel nice to come there, right? So that was the objective. So we had to kind of do a 180 degrees of what healthcare was and try and come up with a new sort of paradigm, right? So on paper now it seems like, why didn't people do it before? But it just needed someone to kind of possibly say that this is what we're going to do.